on this side, you can see the scapula just a little bit more prominently than this side here. There's a little suspicion of winging. So go ahead and lie back down for me, please. So I test the serratus. If you look at page, got there something like Daniel's 85. Back on page 81. So here is the serratus anterior, and if you notice when we're looking at him from the front, the angle of the glenoid is almost facing right out. And so what I do is, if I'm suspicious, when we tested it the way Daniels and Worthingham says, it graded well. But the way I like to do it is in this position, which is the same anatomical position that the humerus is in and the glenoid faces and the serratus goes. I like them to come up and just with the elbow extended protract, which is the action of the serratus anterior if you truly isolate and it's not having. The problem with those other ones, as I showed you, for rotation of the scapula to occur, you need the upper tract and the middle tract and the lower tract. And so if you have, weakness, it's hard to really isolate the serratus, but they don't protract. Only the serratus can protract. And this is totally against gravity. So to me, this is a more sensitive test for that. So then what I would do if she could do that is I'm going to give resistance, same thing, proximal to the elbow. I'm going to go on at the condyles and push up, push up, push up. All right, and then I would have her go up there and don't let me push it down, and I can go 1, 2, 3. I can even put my, my body weight right on this. Serratus is strong if it's intact. Relax. So that was her uninvolved side. So we go over to what we suspect is just a little bit wing over here, and she can go up against gravity. So go ahead. But one of the things you notice is. I want you to do that again over here. Go up against there. Okay. Go back. Go and do it this time. What do you notice going on here? There's a lot more body roll going on with this. So there's some compensation going on. So now I'm going to give a 4 and go ahead and push up. It's hard. And I'm not pushing as hard as I was. Remember, I leaned on her, you saw it with all my body weight. So now I'm going to ask her to hold there, lean my body weight here, hold. And I can push her down by 1003 to the table. So to me, it's a much more sensitive test for, if you see a little winging and you go through the classic serratus test that's described there, and it grades out as a 5. Try and you would just have to say, in supine with the elbow locked, shoulder flexed to 90 degrees, patient protracts directly toward the ceiling, resistance applied, and then you could say, your comparison that you found on one side or the other. So again, it's valid if you describe it, okay? But if you just said I tested the serratus and I gave it a, and here I probably might have gave it a 4, but probably not a 5, because even under 4, you could see her facial expressions. It wasn't. This one was like, yes, so what? This one was like, when she's not comfortable doing it. So to me, that is a much more athletes and sports athletes, tennis overhead athletes, volleyball, things like that. Sometimes you need a better test. So just remember the doctors who tested you will not be tested on it because I would have to test you as per that, because that's the accepted standard. Just know that there are sometimes things that make clinically much more sense, that if you suspect something, especially when we get to rotator cuff, I'm going to show you another doctor's test that's much more sensitive for rotator cuff weakness, but that comes later. So, all right, so